If you have not, then you need to do your traction skill check before you go on to ultrasound, okay? Does it help if I turn this off a little bit? All right, who read the chapter?
Skimmed it.
You skimmed it?
Skimming everything these days.
Yeah, that's not gonna work all the time, but, all right, so ultrasound is a lot, right? There's a lot in this chapter. So the most important thing that you need to understand from ultrasound is what is it and why do we use it, right? What does it do? Why do you, what are you gonna tell your patient? Why are we using ultrasound? So you need to understand those things, right? With these modalities, you will need to understand what the frequency means, what it is, the setup, and we're gonna go through that. Exactly, you know, what is ultrasound, right? So what is ultrasound, Ken? That you understand?
Isn't it that sort of modality technique send certain wavelengths to the body that cause vibration?
Okay.
To heat up the temperature of the muscle itself.
Okay.
And the different wavelengths determine how to heat.
Right, so, or the different frequencies. The thing is this the same as when you do an ultrasound to see where the baby is? No, is this the same as the ultrasonic that they use in the Navy? No, that's where it started, right? And they use ultrasounds are used in many, many ways. But here, ultrasound, we're gonna use it, you know, yes, it creates that vibration. What creates a vibration?
Isn't it the molecules?
Where is that coming from?
You you send the energy through the
Where's that
sound
energy
waves.
coming from? What's producing it?
The machine that produces the sound.
What part of the machine produces the thing? The ultrasound, but where is it coming from? The PowerPoint's not gonna tell you. You should, it was the text. So one other thing, don't just go by the PowerPoint, you have to read the text. The PowerPoint is a reference, right, to kind of keep you, like an outline.
The piezoelectric effect
There
from the
you
crystal.
go. What is that? A crystal, right? That's what's producing the energy, that crystal. And let me get the machine. I'm sure some of you see that. All right. So this is our ultrasound machine. This actually does ultrasound and electrical stim. Different types of electrical stim. So this is your tower that you're going to become very familiar with. The crystal is not in the machine. It's right here in this sound head. This is the sound head, okay? And we will talk when we do demonstration, you have to take care of this sound head. If we do certain things, it's going to crack the crystal. Then we have to buy a new machine or a new head, which are very expensive. Okay, so the crystal's in here. Okay? All right, very good. All right, let's start here. So, the effects of ultrasound. All right, we need to know the effects, the clinical applications. Why are we doing it? It does have contraindications, precautions, and adverse effects. And then we're going to go over the application technique, and then, of course, how do you document your treatment. These are two types of machines. We have this one on the right side. A little bit with when we talk about the application is you almost have to like be able to chew gum and tap your head. And you'll see why, okay? All right, so ultrasound is greater than 20,000 hertz. megahertz. This is this type of ultrasound, that's what we use it for. We're gonna talk about the parameters are the intensity, the frequency. So intensity is watts per centimeter square. Intensity is megahertz. Duty cycle is a percentage. Effective radiating area, ERA, is centimeter squared, and beam non-uniformity ratio. So did anybody read about the ERA? What is the ERA?
The area that it penetrates or reaches.
Yes and no. Yes, but more specifically.
Like the depth.
Well, yes, but
Is that how much of the surrounding tissue is affected by?
right, so, right, it's this area, you multiply it by 2, and that's the only size of the area that you can effectively treat. Okay? So, if you have, we do have one that has a larger sound head. So, again, then we're gonna talk about how big of an area can I treat with ultrasound, right? Because if the sound head, you can only do 2-3 times this sound head, can we treat the whole back? You know, can you do that? No. Okay, so we're gonna keep that in mind, right? It's not for a huge, even with a larger sound head, maybe, you know, if somebody has a big, big leg when you're treating a tendon, then you might wanna use the bigger sound head, right? But you're not treating the whole muscle or the whole leg with this. So the frequency, 3 megahertz or 1 megahertz. So which one, for those of you who read, what does the frequency tell you?
How deep it penetrates?
So how deep, which one penetrates deeper? The 1 megahertz or the 3 megahertz?
1 megahertz.
The 1 megahertz, okay? So depending on what area of the body you're treating, that you just, you're gonna either use the 1 megahertz or the 3 megahertz. Dr. E, pitch in there, whenever. So he's giving you a visual here, right? So the 1 megahertz is gonna go in. How much deeper is it gonna go in? Or penetrate? How much more does it penetrate?
Just 3 times.
Like 5 centimeters compared to 2 centimeters.
Okay,
It says 3 times.
what's that?
It says 3 times. The 3.
One megahertz ultrasound penetrates approximately 3 times as far as the 3. Right, so, but how many, like Alex said, how many centimeters? So the chart in your book, there's a chart in your book on page 187. So if your problem is within 1 to 2 centimeters, you're gonna use the 3 megahertz. If it's equal to or greater than 5 centimeters, you're gonna use the 1 megahertz. Okay? This chart you pretty much need to memorize because this is when you're treating somebody, right? We're asking you, okay, this is your patient. I'm not, I need you to know, even though the PT is gonna give you these numbers for class purposes, we're gonna ask you why you're doing it. Even if I give you the numbers, you have to explain to me why you're doing at 3 megahertz at 100% versus pulsed, okay? There's reasons for those. Continuous versus pulse, what's the difference?
Continuous is just like consistent all the way through, and then pulse
Okay,
is like
continuous
stuck
and
in.
consistent flow. Pulse, then we would say it's not a consistent flow, right? continuous is thermal. Pulse is not necessarily thermal, okay? Yeah. So your duty cycle, when we'll talk about that, is going to tell you that. So these are just graphs that shows you continuous versus pulsed. So these are pulse, duty cycles 20% and 50%. It's just how fast, how many pulses are you getting in, in a certain amount of time. You can do 20%, you can do 50%. Okay? So effects of ultrasound, it is thermal. So it's thermal and a non-thermal. So for thermal, you're going to increase tissue temperature affected by absorption coefficient, tissue type. Intensity, what would be your intensity if you want thermal? What does your graph say? 0.5 to 1.5 to 2, or it depending on your frequency, right? What is absorption coefficient? What is that? What do they talk about with that?
Isn't it just like certain tissues absorb energy?
Yep. So it's going to be more effective with tissues that absorb heat more or absorb heat less. Huh?
Tissues that absorb heat.
And what are some of those tissues?
Soft tissue like muscle,
Okay.
skeletal muscle.
You guys, whoever read, Jacob, did you read? Which
Which-
tissues?
Absorb more.
Mm-hmm.
The fat.
The what?
Fat.
You mean back?
Fat.
Fat, okay. I was like, all right, so if you go to page 173, or actually 174, it does give you a table there, table 9-1. Okay. But in 174, on the right column there, it says, tissues with high absorption coefficients generally have higher collagen content, okay? So heating tendons, ligaments, joint capsules, and fascia. Muscle's not actually one that has, if you look at the table in 173, muscle is there kind of in the middle. But skin, tendon, cartilage, and bone.
Usually bone.
So in your book, you really need to know like all these like thermal effects. You've got to know the thermal effects of ultrasound, the factors affecting the amount of temperature increase. Why do we do continuous versus pulse? Because that's going to affect the temperature. If we say continuous, which is 100% is thermal, then pulsed at either 20 or 50% is non-thermal. And then how we're going to go through it, and how do you decide whether to do a 50% versus a 20% pulse? They're both non-thermal, but when do you go 50, when do you do 20? Okay? And then also know, do you think we can, do a different modality alongside this? Or before or after?
If you're doing another area, you
Huh?
if you're doing another area, you could.
No, the same area.
A different modality.
Yep, different modality, because you do them either like one after the other. Again, that's in your book, okay? I'm not gonna give you guys need to go ahead and read it. So again, it has non-thermal effects, and then you're gonna, what are the clinical indications for that, okay? And then it breaks it up into soft tissue healing, pain control, or shortening, soft tissue healing and shortening, pain control, tendon and ligament injuries. Like, you guys need to know a little bit about how that affects each of them, okay? Because it will affect each of them. We say that it doesn't really work on muscle, but it works on tendons, ligaments, and bone. So when we're thinking of doing a treatment, where is our treatment going to focus on? Joint capsules, right? So we're not doing it on, your quad muscle just because you had a strain. It has to be the tendon, the ligament, the joint capsule, right? In those areas.
More for like a patient with like maybe decreased range of motion, would apply
If, well,
ultrasound.
who would have a decreased range of
Let's
motion?
see, total knee replacement, you have decreased range of motion, a knee. You could apply the ultrasound while you're stretching them, and there's no
All right.
precautions for that.
Right, we have to see if there's precautions for, right, what's happening when you do ultrasound? You're heating up.
Yeah, so you're
What's a total knee replacement? What do they have inside?
Metal.
Right? So we have to kind of see if that is not a contraindication. Okay, did you say something?
Oh yeah, I was thinking, when in Korea, the area is free, or is it like too much?
And remember,
Yeah. So
the size of your head,
we usually don't do that.
right? Because when you're treating a ligament or a tendon, are you having to treat a big area? Or are you specific in an area,
Specific.
right? So these are your applications, why we're doing it, right? And they have specifics in your book that you guys need to read through that. So this is an example of how they're using the ultrasound to stretch, right? They have a weight on there to help with that, but your book details what you need to do after you complete the ultrasound treatment in order for this to be effective. Right? So here are some of your contraindications. I think I uploaded one of those score builders and Cameron ones. So contraindications: malignancy, pregnancy, CNS tissue, joint cement. If there's a joint replacement and they use cement, then you don't do it. Plastic, so if some of those joint replacements have plastic or some form of that, then pacemaker, thrombophlebitis, eyes and reproductive organs. Yes, they have to put that there because somebody probably tried at some point to do it over your eyes. Right? So, no, you can't do it in acute inflammation because why? Why couldn't you do it in acute inflammation?
Because it's heating it up.
Huh?
It's heating it up, so
Yeah,
it
you're
causes more.
getting, even though you're doing, even if you may be doing, again, this is where you're like, acute inflammation, how acute are you, where are you, can I do a pulse? Can I do it at 50%? Can I do it at 20% and see how that goes? Epiphyseal plates, fractures, and breast implants. Again, somebody must have tried. Dr. E, anything to add? Huh? Yeah, well, we talked a little bit about the non-thermal, or the non-thermal one.
There's actually really good research on non-union fractures for ultrasound.
I think
It's
it's
just not a machine like this. Much lower frequency.
page 180 of the book of hospital.
Okay.
Yeah, it's all in there. There's bone fractures.
So it says pacemaker too.
Mhm.
Why would you think pacemaker?
Metal.
The electronics.
Okay, so can you do it on the right shoulder?
Where do they let's go back. Where do they normally place the pacemakers?
Over the left side,
Huh?
on the left side, like
Where,
above
though?
it, like above the heart area. Like,
Huh?
Anatomy, where's our heart? So can you do it on the right shoulder?
yeah,
It's listed as a contraindication, not a precaution.
Right.
So what does that mean?
Don't do it.
Tell me.
Well, you
Okay.
you're putting it on their back of their knee.
You wouldn't?
Stand firm if that's what you believe.
Well,
I was right around the way.
just think it through.
I mean,
Think
it
it through.
seems
Think it
far
through.
enough away.
Pacemaker does help serve like the electrical, not in the
You're right.
Plus, look at this. The area, the back of the knee.
So again, with these contraindications and precautions, we have to think the same way throughout all of our treatments. Malignancy, pregnancy, CNS tissue, the CNS tissue, where is it?
Brain expenses.
Okay. Brain and spinal cord. So where are we not doing it to be not over CNS tissue?
Extremities.
Can we do it on the cervical extensors, suboccipital area?
well, does like that, frequency? Cause if you're only getting into the superficial layer. Is that too
Are the
close to
suboccipitals central nervous system?
No.
So you don't do it on the spine, you don't do it on the brain. You need to think through these things and why it would be a contraindication. If somebody's pregnant, should we just not do it anywhere? Can't do it on their feet, can't do it on their knee? No, why is it a contraindication? These are the things you need to think through. So if somebody has a pacemaker, yeah, you can do it on the other shoulder. Even probably do it on the thoracic region. Because it only goes to 5 centimeters. How much is 5 centimeters? That's 5 centimeters? You need to get out
a
the.
measuring tool.
It's like
it's like-
close to 2
It's more like one.
And so again, then you have to
No,
know
it's like
how
2.5
big your tissue is
centimeters.
too. And you have to know where your tissue is and how thick it is. Lumbar paraspinals are gonna be different than medial collateral ligament. It's gonna be different than lateral condylitis. It's gonna be different than a radial head issue.
And even within, Natalie's shoulder is different than your shoulder. So we can't say, oh, for all shoulders, we're gonna do the 3.3. Or it depends on the shoulder. Whose shoulder is that? How
Yeah.
bony is it?
You know, the tissue, I'm gonna ask you, what tissue are you trying to affect with the tendonitis? Muscle?
is it palpation? Kind of what
You guys don't like to touch tissue.
All right, so let's think those through, right? So one of the biggest thing is burns. Okay? You always have to move the sound head. Cross-contamination, infection, just clean this thing, right? Clean this thing. If you don't move the sound head, it's like a little laser thingy, zzz, you're gonna burn. So know that, what should somebody feel when you're doing ultrasound? Should they feel anything? No. Why?
Because you're not thinking it's hot.
Would they
Huh?
not-
It should be getting hot if you're doing it.
Should you feel heat with ultrasound?
No,
Why not?
because you're moving it enough to where it doesn't accumulate.
Yeah, well, you should be moving it, but
Yeah.
regardless of whether I move it or not, if somebody feels heat, is that normal or not, and why?
No, because it's a sign that it's like too localized in the area.
Okay.
It's just burning that tissue,
Okay,
where it should be like evenly dispersed throughout the area.
okay,
It's in the whole idea of ultrasound to get deeper into the tissue.
right,
So if we're hitting the receptors on the skin, we're causing a pain response, it's not getting deep enough, so it's
right.
not in the right.
Do we have pain receptors deeper in? You have to find that out.
Tear a muscle, does it hurt?
I mean, if you even have nerve, like, pain receptors in your bone. I was just looking it up yesterday, I just had a random question for myself.
There are some tissues that have pain receptors and some that don't.
So we're treating what? We're treating ligaments, tendons. Do they have pain receptors?
Yes.
You need to go figure that out, and then next time, we're like, yes, because of this, you have to tell me why, right?
They're mainly in the capsule, the synovium, the ligaments, and the tendons. So, I'm doing the research, but I need like a clarification.
Yes.
Yes, there are.
You should not, your patient should not feel heat. Right, so if they do feel heat, we need to adjust the parameters, okay? These machines have a head warming feature, okay? So if they feel heat, then you need to realize, did you put the heat warming feature on there? So they should feel the heat from the head, but not deep. Okay, what else should they not feel? That's like a big red flag. You think, what other sensation, if this is too much or it's doing damage, would they feel? Besides hot, heat, huh?
Pain or burning?
Okay, so the burning goes along with the whole heat thing.
Pain?
Why would you maybe feel tingling? That's almost not what I'm looking for, but if you go over,
A nerve?
okay. What's that?
Or heat information.
It's a very, very distinct sensation. Huh? I can't hear you, sir.
Thinking.
Achy? Along those lines, magnified. Sharper.
Stabbing.
Yes, a shock. You have to turn off the machine right away. Okay? You can try and adjust the parameters. If it's still that, then you just stop. Sometimes it's, something wrong with the crystal. And we did have that several cohorts ago. One of our machines kept shocking everybody. So then we stopped using it. I hope they replaced it.
Find out.
It was one of those bigger ones, the bigger heads.
The aching too, if you're over, where bone is closer to the body and it's too hot, it will feel achy, like the bone ache.
So again, you're going to get your treatment plan from the therapist, right? But you need to be able to evaluate, or not evaluate, assess how the treatment is coming along, how are they responding, and if you, you're the one that's gonna see those issues, and then you would have to, adjust the treatment, discuss with the PT, hey, you know, I think I had to decrease the intensity because they were feeling that achiness, or despite, I went down into 0.5 and it's still feeling it, so maybe it's not something for them, okay? So they're gonna evaluate the patient, the PT's gonna determine whether it's appropriate and safe, and then you get the ultrasound, you're gonna select the head, we only have the small head on this one, the other two machines have larger heads. Select the treatment parameters, the PT's gonna tell you what to do. Again, we're gonna go through turning on the machine, moving the sound head, and then we're gonna go into documentation, okay? So the parameters are your frequency, either 1 megahertz or 3.3. And how do you determine the 1 or the 3.3? How deep do you wanna go, right? The depth of it. Duty cycle is either continuous or pulsed, or thermal, non-thermal. Continuous is thermal at 100%, pulsed is pulsed at 20 or 50%. You use any other percentages? Book only says 20 to 50. Okay.
They're 100 or 20.
Or 20, yeah.
50% rarely used.
And I'll try to
So question?
On your dosage sheet says 10, 20, or 50?
On the dosage sheet?
Parameters.
I think there was a resource.
Oh, the algorithm? Yeah. We'll look at that right now. Intensity, right? That's the power. So if you're using 1 megahertz of frequency, that's your range of intensity, and then the same for the 3.3. And then the duration is on page 188. I don't know where it is.
I don't see it either.
185. So my book is a duration.
Oh, yeah, 185. Section number.
Okay, for most thermal or non-thermal application, ultrasound should be applied 5 to 10 minutes for each treatment area. That is twice the ERA of the transducer. What would you usually do in clinic, Dr. E?
Well, we worry about billing, so.
Yeah, 5, 8 minutes.
And there's this whole equation on the depth and the percentage and the area that brings you to a certain number, 2 minutes or 3 minutes, that brings the area up to the temperature that would increase the circulation. But typically it's 8 minutes, 10 minutes. You could do 7 minutes on each side, get 14 or 8 minutes on each side, do 16. You have to worry about that 8-minute rule. We're just doing 5 minutes. You can't bill for cleanup and setup and all that stuff. So we just do 8 minutes.
You know why is 8 minutes? You guys remember why it's 8 minutes?
Rule of eights or something.
What happens at 8 minutes? You have 1 unit. Okay? If you continue reading under duration, it does give you an example of what Dr. E's talking about in terms of how they come up with the time. Okay? And I think for purposes of you guys practicing, we'll just do the 8-minute rule here. 8-minute treatment when you're giving each other a treatment. Okay? Documentation, again, treatment area treated. And of course, you're gonna put what position your patient was in. you're gonna, note the frequency, the intensity, the duty cycle, the treatment duration. You're gonna say if you did this underwater or not. This can be done underwater. And then in your assessment is their response to the intervention, okay? So for example, if we just look at the algorithm here, where is it? Is it even on here?
Slide 17?
It's right before documentation.
Right after that.
Ah, so you're gonna say, ultrasound to, Achilles tendon, right Achilles tendon, patient prone with right lower extremity elevated, 100%, 1.0 centimeters, 3 hertz, so you're gonna say 100%, 3 megahertz, 0.5 watts per centimeter square times 10 minutes or 8 minutes. Right, so you have to just list all of those parameters with their respective centimeters, watts, whatever it is, level of what do you call it, power or whatever. Okay?
So every item on this,
Yes, except for the depth, the one, it says depth of problem.
okay.
When you write 3 hertz, we know it's 1 to 2 and 1 megahertz is equal to or less than 5.
Okay.
Remember an example for me? Oh, okay. 1 hertz, 100%.
Does that say 1.0 or 10?
1.0 megahertz, 100%, 1.0 watts per centimeter squared times 10 minutes. Minutes, you just go to 10.
Okay. Again, when you're charting, make sure you put those points because it can't be 10. Obviously, we're not going up that high. Okay? So make sure when you document that you do the points, right? And then, yes.
You only specify if it is underwater,
Right, if it's not underwater, then you're just not gonna, it's by exception, right? So you would say performed underwater. When would we perform something underwater? No, ultrasound.
And then you wanna hit an area where someone can't really support themselves, so it might be like,
Well, we're not talking about, yeah, I see, I know where you're coming from. But we're not talking about doing ultrasound underwater because the patient can't sit or do anything. It's not about their mobility.
Patient can't be in prone or something.
This is for wounds.
Could you do ultrasound on a wound? If you're underwater, why couldn't you just do it over it?
Can't put the gel on the wound.
Okay, you would have to put gel on them, right? So that might compromise the wound. So when you're doing wounds, you're gonna go underwater, okay? What else?
What body part would go
Hmm?
in a little tub? Why? Why would that be in water?
No, not because it can fit.
Circulation different?
Sort of. How much is the sound head touching you? And we don't want that. You need
Full
congruency.
contact.
Full contact. What about going over the bones like this? You think that's gonna feel good? How many centimeters are the bones under my skin? Right there. I think that's gonna feel good. But if we, instead of gel, have the water, we can go over this irregularly shaped area. It's a lot safer and more comfortable.
So another application is phonophoresis. What is that? Somebody know?
Medication.
Delivery of medication through ultrasound.
So what was the name that you said?
Phonophoresis. It's in your book, page 180. So why would you want to deliver medication through this medium? What kind of medication are you giving them?
Topical.
Yeah, it's topical, but what kind of medication? What for?
Enhances the delivery of the drug through the
It
skin.
enhances the delivery of the drug. What would be the drug?
Maybe like a pain reliever or.
Okay, pain reliever. Okay. Why would you do it this way versus having somebody just take it by mouth?
So it doesn't bother their stomach?
Okay. Does that mean then that it doesn't go systemic?
No. You can still go systemic.
Yes. Have you guys ever looked at those NSAIDs like Voltaren? Right? You read and you're like, oh, this is a cream, I'm gonna put it everywhere. You can't put it everywhere. And it still is like you took the meds, right? It's a dime size equal to how many milligrams of NSAID. So if you rub it on your knee, you can't take more PO, right? It still goes systemic, but it bypasses the stomach if somebody's having a lot of issues with that. Okay, questions? Any questions? So we're gonna go through the application. How do we do it? We're gonna demonstrate. And then, again, go through those parts where like, how do you, not just how you turn on the machine and how you set it up, but we have to work through the patient you have, right? This is what we're going to do. I would, this is on a separate sheet for you as a resource. I would have that handy. So when you're practicing your ultrasound and we come up and say, why are you doing it at, you know, or give you a patient and say, okay, what are you gonna do for the frequency, the intensity, you know. You're not gonna have to come up with that in clinic, but you need to come up with it here, so we know that you understand why it's those numbers, what those numbers mean. Okay, so I would have that handy.
The parameter sheet
This, yeah,
that includes this? Or
yeah, that, I think it's just in a big form for you. It's in your book too, it's the
there's
same one,
like 3 pages.
yeah. Okay? Again, the ultrasound, we'll go over, has to be continuously moving. You can either go circles or waves, never stop, never just like this. You never